Hello and welcome to another episode of Low Tech Health. I am bringing you Meatless, Eatless Mental Mushroom Monday. Today's theme, in a word, refusal. In another word, many words, going to be explaining what began to break my high idealistic view of what hospitals do and the hospital industry upon coming in my first year as a nurse. The language, to begin, is defensive. The jurisprudence use of the words refusal, denies, puts the burden on the patient to have either lied or hidden something. And this, I believe, is unfortunate. Because on this episode of Meatless, Eatless Mental Mushroom Mondays, we will try to take a closer look at why a patient would need heparin on a day 2 of hospital stay after developing a stroke with no other past history besides hypertension, smoking, and underlying atherosclerosis, hardening of the arteries. Why would they need a powerful blood thinner upon day 2 after being in the hospital? Crossing the threshold, are they somehow more at risk for having blood clots form and release and shoot into their brain, heart, lungs, legs? Will heparin help this? This is Rosemary. I've been outside gardening this lovely day. It's been a beautiful one, I must tell you. This is Rosemary. Helps me remember. The patient on day 2 of their hospital stay does not want this heparin shot in their belly, this deep into their subcutaneous tissue, to help prevent blood clots that may or may not be forming based off of their prior medical history of hypertension, smoking, and atherosclerosis. But instead of saying, patient does not want this heparin shot, patient has questions about the heparin shot, we say, patient refused. Patient is no longer compliant with their medication. Patient is now non-compliant. They are heading towards operating in a state based of against medical advice. Not only is this used when patients want to question or have other ideas about the medicine they are being prescribed, this refusal of care, this non-compliance with their medication administration, but it is used when a patient says that they do not smoke or they do not do any illicit drugs. They are said to deny drug use or alcohol use. Patient denies. Patient might be lying, is what I am hearing when you say such a accusatory assumption. Is this purposeful? Is this something that has developed over the years of litigious battles in hospitals? Is refusal necessary? Is refusal something to be looked down upon, is the real question. Or is refusal necessary? Is refusal absolutely the way forward? I think in these times of compliance, for the sake of compliance, we must question. We must refuse. Thank you for listening. I'll see you tomorrow on Let's Talk Tickers and Taco Tuesdays. Peace out, Girl Scouts.